I've been a midwife for over 36 years. In New Zealand currently, 1 in 11 women develop diabetes in pregnancy. And it's a particular diabetes that only occurs during pregnancy. So basically when the baby is out, the diabetes goes away. Why we're so worried about it is because if it's not controlled, one, the baby grows very, very big and the woman might need a caesarean section, but also in long term, if it's uncontrolled, more likely to have heart disease issues. So part of my research was to find out, well, what are the barriers for them actually making a difference to their blood sugar levels and to their lifestyle. In New Zealand, there are not enough resources for diabetes in pregnancy clinics. Each DHB seems to have a different model. So for some women, long waiting times, not having it their own language. It's not just the lifestyle and changing what you eat, but it also is about being active. As we do a diet plan, we need to look at an activity diary. We have a lot of women that go into our diabetes clinics, don't necessarily follow the diet that's recommended, or they don't turn up. Why is that? The variety of research have also been involved in a randomized controlled trial called Target that was looking at what should the blood sugar level be that guides women. And we found that if we do on a very tight blood glucose level, that group did much better. In fact, no babies died in that group, so that was really a relevant finding recently. However, those mothers also bled quite a bit after the birth. So the answer wasn't quite straight out there. Part of my research was I interviewed 60 women within New Zealand, and all of them say it's such a shock. Even though they get explained before they do the test what it's about, what it means, everybody thinks it's not happening to them. I will be flying out to Myanmar to work in a refugee camp for 3 weeks where I will be teaching obstetric complications that could occur to first aiders in this huge area of Myanmar, which is a huge refugee camp. So it's exciting that I have this privilege of sharing the information.